Good evening, everyone. Today we're going to talk about Western View Emergency Response Plan. It is very important to have an emergency response plan in place because it's not about if a disaster is going to happen, but when it is going to happen. First of all, we are going to discuss the prevention. Prevention focuses on identifying and reducing risk before they escalate. At Western View, they will conduct risk mapping around highways, tunnels, and freight lines near the hospital. These items will be reviewed and updated regularly. To stay prepared, there will also be emergency contracts created with key suppliers for medication, oxygen, hazmat suits, and fuel. These agreements guarantee that even during a crisis, critical resources will be delivered. Next, we're going to go to protection and preparedness. Protection is going to ensure staff and patients are shielded during an emergency. Western View will maintain a stronger stockpile of PPE and essential equipment and a real-time inventory system that sends alerts when supplies are low. This ensures they can act quickly without shortages, slowing the response. In addition, preparedness is essential in building readiness across people, processes, and partners. Both initial and reoccurring training for staff with extra focus for new employees will be provided. They will maintain and practice clear evacuation plans and work closely with outside agencies to coordinate responses. These actions will ensure everyone knows their role before a crisis happens. Next, we're going to move on to mitigation. Mitigation reduces the impact of emergencies when they do occur. At Western View, quarterly HVAC system stress tests will be ran to confirm the ventilation and filtration can handle chemical exposures. Decontamination capacity will be added by adding more tents and training non-clinical staff to help during patient surges. This approach keeps the hospital functional while limiting risks to staff and patients. Now, once a crisis occurs, the response is imperative. The response requires rapid and coordinated action. Mass casualty incident protocols can be activated or should be activated, which covers triage, surge staffing, communication trees, and resource tracking. A centralized command center serves as the communication hub, streamlining coordination across EMS, hospital departments, and even the media. This approach keeps everyone aligned and reduces confusion during high-stress moments. Just important as response, though, is the recovery. Recovery focuses on restoring services and learning from the event. So within 72 hours, Western View will hold debriefs with hospital departments and local agencies to caption lessons learned. They'll also provide support staff services, including mental health counseling, flexible scheduling, and backup staffing to relieve pressure. This ensures recovery happens both operationally and emotionally. Now, once the 72-hour debrief is done, it allows them to identify continual improvements. Continual improvements ensure they grow stronger after each event. Feedback will be collected from staff, patients, family using trauma-informed anonymous surveys available both digitally and on paper. In addition, once a year, a full-scale emergency drill will be conducted with local agencies. Afterward, a written improvement plan will be developed to capture, again, all the lessons learned and make any needed changes. Resilient strategies are important too. Resilience means more than just performing in the moment. It's about adapting, recovery, and sustaining operations. One of the first strategies in resilience is building redundant support systems. This goes for staff, patients, and community. For staff, they're going to establish cross-training programs so employees can step into multiple roles when staffing is stretched thin. This prevents burnout and ensures critical functions keep running even if some staff are unavailable. For patients, they're going to maintain backup power and redundant care systems such as portable oxygen and manual charting to keep patient treatment safe and consistent when systems fail. And for our community, they're going to partner with local agencies and volunteers to provide alternate care sites or mobile clinics during disruptions, ensuring community members can still access essential services. The second strategy for resilience is strengthening of communication and mental health support. Again, for staff, patients, and community. Staff will be provided mental health resources, peer support groups, and clear communication channels so they can cope with stress, stay informed, and remain engaged throughout the crisis. For the patients, they'll develop reliable communication systems, backup phones, interpreters, patient liaisons to keep patients informed and emotionally supported during the emergency. And for the community, they're going to coordinate public information campaigns with local officials so the entire community receives accurate, timely updates and resources. This will reduce the confusion and the fear. Together, these strategies create a hospital that is able to adapt, recover, and continue serving even in the most challenging emergencies. Thank you, everybody, for your time, and have a great night.